Hello guys, welcome again to another health talk session with Medical Expo Africa. Yeah, so today we are going to talk about common cold, cough and flu.
Yes.
Yeah, so let's dive right in. However, let me first introduce my counterpart, Dr. Rachel.
Yes.
Dr. Rachel Asio. Yeah, we work together at Children's Clinic Nadia, work with children. So yeah, I think we have experience with children who have cough and flu, and we're here to let you in onto this conversation about cough and flu. So, doctor.
Yes, please.
What is a common cold? Because I believe most people hear common cold or stomach flu.
Yes. Okay, firstly, a common cold is contagious, but it affects the upper part of the respiratory system, the upper part where you breathe and take in air. That's so it affects the upper part of the respiratory system. That is, the nose is affected. We have the throat being affected, and the sinuses, which are spaces around here. We have around here. We have multiple areas with sinuses. So in there, the person can have a flu and a cough. Yes. But I think we shall delve deeper into the other symptoms, which you will share with us.
Yeah.
Yes.
Okay. So what are some of the symptoms of flu and cough, the general symptoms? So you see your child, they have a runny nose, they're sneezing, they could actually even have a fever, a low grade or a high grade. A low grade is like when it's not so, the child is not so hot, and high grade when they're so hot. The temperature is above 39, because I believe most parents lately have thermometers where they check their children. Very informed patients.
39,
yeah. So we could also have a child coming up with ear pain, says, "Mommy, my ears are paining," they're tearing, they're sneezing, they could even have a sore throat. Yeah, so they even sometimes get pain when swallowing saliva. So all these are symptoms of a common cold. Yeah, maybe doctor, you would want to add on to that.
Well, yeah, you've said everything. You've literally covered everything. But we can just add that common cold could mostly, there is a reason why we call it common. Because it is quite common. And it's common because even the mode of spread, the way it comes about is through air. I will sneeze.
Yeah.
You will get it, you know?
Really, I believe that everybody once or twice in their lifetime has actually suffered from a cold.
It's common.
It's so common. And the reason for this is because it's caused by very many viruses, and these viruses keep changing their morphology, they keep mutating. So you get immunity for one virus, and then it changes, and then it affects you again, you still get sick, and then you just
so
keep
like
so you're building immunity against so many viruses throughout your lifetime. I think let's talk about what are the symptoms of colds in the babies, the little ones who are
yeah, so the little ones can also come up with a fever. They can have sneezing, congestion. You know, it also affects their breastfeeding. Someone will be like, oh, they're not breastfeeding, or they make a funny sound because while I'm breastfeeding, you've had that a lot. So they have flu, they have a cough still. Mostly they have difficulty feeding, which could actually show maybe there's something going on with their throat. So like a doctor has to check the throat and see. Ear pain, like you said, they don't really say that, but we in examination have to check the ears just to make sure everything is okay.
Actually, on top of that, mothers always complain that my child is not breathing well. They're so uncomfortable because of the flu in the nose, the swelling inside. You know, there are certain organs inside the nose that swell up, and the child is not able to breathe properly. So how do cold symptoms differ from more severe infections in children? How can you tell that this is a cold and this is something more severe than a cold?
Firstly, we have to look at the appearance of the child. You know, a child will come in and they're playing. They just have, I'm just coughing, and that's it. I'm just having a flu, and that's it. But then a child comes, they look so toxic, they look so sick. That is the first thing. We take note of that. Then, of course, we are going to examine the whole chest and see both the chest and the back. We listen. There are those funny sounds that are beyond normal that we can tell, this could be something else. How is the child breathing? Let's first start from there.
Exactly.
Are they breathing so fast? That means this is something different. Also, how long have they had the cough? Is it more than 4 weeks? Are we still coughing more than 4 weeks without any breaks in between? Because let's consider you're going to school every day. You could get relief, then get another reinfection because of the way children are in general. But has this cough gone beyond 4 weeks? Are we still coughing non-stop? Yes. Do we have a recurrence of a fever? Like we had a fever before, now again we're having a recurrence of even a higher fever.
Actually, and fever in children who are less than 2 months.
2 months, yes.
That is usually a danger sign. You should bring them to the hospital.
And if we're now talking about kids that are less than 2 months or less than 6 months or less than 1 year, you have to consider other signs. Are they crying excessively? Are they so irritable? Their mood, is it so low? So those are other danger signs that we need to consider. Are they eating well or their appetite has really gone low? Because their presentation is a bit different from the usual. Actually,
these children, they get much worse than the older ones. They even can actually develop a pneumonia. So if you see these symptoms lasting for more than 4 weeks, you see a child, like when they breathe, you can see the ribs.
Fast breathing,
fast breathing. When they breathe, you can see the ribs. When you see the nose is flaring, flaring is this, the nose is doing that. You should really take note of that and bring the child to the hospital. So I think we already talked about what causes the common cold. We talked about viruses, but maybe give more detail about that.
Maybe we shall even give more details in how it comes about. We've talked about the coughing, like droplets all over the place. And then a person you'll just easily get it because it's airborne. But secondly, surfaces. Now let's talk about the children that go to school and then there's a baby at home. Mommy, you need to make sure the child washes their hands.
And they isolate. It's so hard, but
because it's really difficult because there's that love. And
what's your baby? They love their siblings.
And now what of the mother who gets the flu? Now that's difficult. So isolation can be a bit difficult. But we have to maintain sanitation. After blowing your nose, wash your hands, cough and hold your mouth, because don't just cough all around. So these are skills that we have to teach our children. So there's that touching surfaces that are already infected and then touching your eyes, your nose. I'll just relate this to COVID. We really say in COVID, do not touch surfaces, do not touch your
just
eyes,
because COVID is not there anymore doesn't mean that you don't need to practice those hygiene practices you have. That's sanitation. Wash your hands, sanitize, don't touch the soft parts of the face.
Now for a kid, you have to clean the toys because they're always playing with the toys.
Exactly.
So you have to clean them. So sanitation, the air, the air is a little
I think that's one of the reasons why children get more colds than adults. And then another reason why they get more colds than adults is because their immunity hasn't yet picked up. Because they've not yet been exposed to different viruses. We call them the new people. They are new people. So, the environment is curious. The environment is curious.
About them.
It's curious about them. So any small thing, they get attacked. But don't worry. The thing is, the more they get flus and coughs, the more they build their immunity. So that in later stages when they get cough and flu, it doesn't really treat them as bad.
Because you can see now as adults, we get flu, but it's not as
as debilitating as children.
And then the breastfeeding part for the little ones. You see, as a mother, you're an adult. You've seen so many flus and coughs. So those antibodies,
in your breast milk,
in the breast milk are going to really help the child.
That's why we always advise mothers. We're going to talk about management. They will actually advise you to breastfeed your child because you're passing on to antibodies that you already have in your immune system onto the baby. So the baby is also able to fight off the virus.
And then let's just talk about how also breastfeeding with a congestion in the nostrils, it helps because the baby is drinking and hydrating. And, we advise just drink breast milk, exclusive breast milk. So for less than 6 months old, definitely we have to breastfeed as much because hydration is important.
Very important.
Decongest those nostrils.
So, doctor, how can I manage a common cold at home?
Okay. So if we have really given you the surface. We said most colds are viral. And viruses don't need anything big to treat, like antibiotics, no.
Actually, antibiotics do not treat common colds. They don't treat viral infections. So let us stop self-medicating with antibiotics. The only time you're supposed to get antibiotics is when you have gone to the hospital, you have done some tests, they actually reveal that in your blood test, this and this shows that the child might actually be having a bacterial infection. And antibiotics are supposed to be prescription only.
Yes.
Do not go to over the counter and they give you antibiotics for cough and flu before they actually test. Because now, you know, with this self-medication that's coming up, you're going to realize that people are getting drug resistance.
Yes.
So the next time the child, they're not working anymore. So the reason for this is because people are self-medicating. Yeah, you go to a pharmacy, my child has a cough and flu, and pick looks, you know. And they always give you that most expensive brand, because they want to make money. Because they have to make the money. They will even give you a very, very potent drug that actually would have been used for a condition that is much more serious than the cold that they have. In a sense, so let's not self-medicate. So let's talk about supportive treatment for common colds and flus.
Because you see, we've said it's viral, so we have to support the patient as much as possible. Because what we are supporting, we're dealing with the symptoms, what the child is presenting.
Yeah, because the symptoms are very, very uncomfortable. The fever. The
fevers.
The cough.
Yeah. So the congestion, we can actually give, we can take warm teas. We can have some ginger because it helps with the decongestion. We can take warm baths. Take warm baths. It helps to decongest.
Yeah.
Yes.
And for the small babies, actually, because they can't blow their noses, we usually prescribe some saline drops. Yeah, to help thin out the mucus, also help open up the airway, and the child breathes better and continue breastfeeding.
Yes, and the mom can also help the child. We have what we call, like, it's a bulb syringe, something that can suction out.
Help suction.
So you drop some saline drops and then you try and help. If it's too much that the saline drops are not working, you might need that whole suction to just help out the child.
And for the fever.
Yes.
And for the fever?
Okay, fever, if it's not so bad, remember fever is an immune response. So certain organisms like a certain temperature, certain germs like a certain temperature. So the body tries to increase the temperature so that it can distort the organisms. So sometimes we allow the fever if it's not extreme.
It's not too bad, not high grade.
Yes, and it's not affecting the child basically, because it can be a low fever, like you said, a low grade, like a 37.5, 0.6. So we allow the child. We just support. And like we said, the supportives, we have some ginger, we have some garlic, some lemon.
Onions.
Yes. So they tend
honey.
to reduce that swelling of the nostrils. So even the fevers calm down because it has the swelling, it deals with that. So we can really support. Yeah. Honey, but for more than 1 year old.
Oh, guys, please, honey is not given to children who are less than 1 year old. The reason for this is because they do not have the enzymes to digest it well. And even you see the honey, most especially as in Uganda, we get honey from the villages. It's not purified. It has what we call botulinum toxin. And this toxin, when you give it to these children, because they cannot, like when they ingest it, the stomach acid or whatever cannot actually kill it in those children, they will end up getting what we call botulism. Botulism is actually a very, very bad disease. Why you see your child, ngaria, or they're just there, not doing anything, and also complications. They'll actually suffer more complications further. So do not give honey in children who are less than 1 year. And actually what I advise, people say, oh, that concentrated honey is the best honey to give, a child. That honey is not purified. I would prefer that you go to a supermarket where you get honey that is sieved, purified. They remove all those impurities, and it's what you use to give the child. And also lemon. I think we abuse the use of lemon very much. You overgive lemon, and and the child starts getting
stomach lining. Yes.
So give subtle amounts. Same thing with garlic. You give subtle amounts. Don't shoot to kill.
We should first leave
the garlic and lemon
to something simpler,
like onions and honey. Actually, the concoction of onion and honey, the water that comes from it. Give a teaspoon every 8 hours. I believe
it's like medication.
Exactly.
A medication time every 8 hours. We get something.
And also, let's not abuse the herbal medications, because I know we get herbals from pharmacies or from wherever we get them. You don't even have a proper dosage. So the more that you keep giving this child these herbal medications, the more that they are actually going to have their livers affected at the end of the day.
Let's talk about drugs. Drugs are poison.
They are poisons,
so
actually.
There's a certain dose. That's why we're like, okay, give this dosage so that it can be effective. We don't want
kill the germ. We don't want to kill the host. We are killing the germ. So for you overdose and you want to kill the person themselves, they are poisons. Yeah?
Okay, so back to the common cold. What's your take on these cough syrups that are parents?
So now these cough syrups, like I said, drugs are poisons.
Exactly.
Let us not abuse them. So the more that you will overdose this child, last time they gave me this syrup, I think let us use it again. You do not know why the doctor prescribed this certain syrup for the common cold that you have. You do not know why they did not give you the other. You understand? But the more that you give this child, first of all, you might not even get the same results that you did. Secondly, these syrups actually have side effects. So maybe doctor, talk about the side effects of these syrups.
So most of the syrups, firstly, can cause drowsiness in children. Actually, we don't advise cough syrups. Less than 6 years old, no, we do not. Yes, and so we have drowsiness. You can even get hallucinations. You can get respiratory depression, a downward spiral. Yet our issue was cough. Now it's going to a downward.
So they're getting worse than.
And then when we look at cough is an immune response. We cough when we have something. I'll give an example. When you go to a place that has smoke, you find yourself coughing because the body is trying to remove that irritation. So we don't want to fight the body, it is fighting for us.
Exactly.
You get it? So we're not fighting the body when it's trying to defend. It's just like having a fever. The body is trying to help you out. So sometimes we don't want to fight it. The only times we can actually consider a syrup, maybe if the child is coughing non-stop throughout the night, they are sleep deprived, because, we talked about sleep, which you guys should tune in and watch.
Actually.
But, sleep can lower your immunity, because if we're talking about enhancing immunity, we need to rest. So if that cough is affecting, then if we have funny sounds, the wheezing, that musical sound that you hear, that one, yes, you'll have to find a way. If there's so much congestion in the chest, if you're having difficulty in breathing, so there's certain instances we can consider.
Not every cough and flu needs a syrup.
Yes, so we should allow the patient's body fight. We need to support the body to fight. Yes. So
okay. Thank you very much, Dr. Rachel.
Yes.
I think this was so informative. I think we have come to the conclusion of our talk.
Maybe just a simple thing about the flu shots. Do you have anything to add about it?
So the some vaccines that are given to children, even adults, every year. So they're called, we call them flu vaccines or flu shots. Actually, in Uganda, I'm not sure if it's very, very, very famous. So most people do not, but it actually helps. So if you get a flu shot every year, you will not get as much
maybe for that
colds
virus,
and flus.
Because we said there are more than 200.
So many, but the most common one, which is we call it the rhinovirus. When you get vaccinations for those, even the coronavirus, actually,
and the influenza,
viruses, all those. So if you get a vaccination for this, actually, the frequency of flus and coughs in your child will actually reduce.
For that specific
virus. So thank you very much, everybody. Thank you very much, Rachel. Thank you for tuning in. We are having a medical expo from the 7th to the 9th of September. We're going to have very many health institutions coming. We're going to have talks from health experts, and the entrance is only 5,000 shillings, where you're going to come in, get consultations, health information from very, very many various health experts. So come one, come all. Bring your mothers, bring your friends, bring your children. Yeah, it's going to be a very, very informative event. See you all there. Thank you very much.
And then if you have any questions on the topic that we have discussed, please comment, like, subscribe. Let's interact. Just believe that we shall reply all the questions that you have.
We shall.
Okay, take care.
Okay. Thank you.